doing?
Oh, good morning. I'm very good. Thank you.
Well, good. So you're about 6 months out from the procedure we did on your lumbar spine. Why don't you tell me a little bit about what you were doing and how you were feeling before you had the procedure done?
So I've had a tear, a fissure in my annular ring, and then arthritis, great pain to higher, more pain. It was just undulate, and I just couldn't, none of the things that, in the past I've had steroid injections and physical therapy, and there's just nothing that seemed to do the job.
And since you had the procedure, how have things been since then?
So within just about the 3-week point, the biggest pain, which I think we talked about, was the annular ring. That pain is gone. It is completely gone. And then my back has greatly improved. I can still, if I do too much, I can feel maybe the arthritis, but I am greatly improved.
That's fantastic. And how did you find this originally, Mike?
So a person from my hometown was talking to my father, and she mentioned that you had helped her tremendously, and she had a lot more clinical signs, a lot more problems with her back than I did. And she said, and I've had like 15 years of issues. And my dad said, I have to tell my son about this.
That's fantastic. And as far as your experience with our office and the procedure data, what would you have to say about that?
It was very smooth. Everything you said was exactly the way it happened. We came in at 9 o'clock. You were right there taking care of me. I walked out at noon, and very, very little pain that day. We were from Indiana, so I ate some lunch, took about a 2-hour nap, and we got up and even kind of walked around very slowly. I just was very careful, but virtually no pain at all.
That's fantastic. Anything else you'd like to share for people looking at these videos that I didn't ask you?
It's just been a tremendous success for me, something that I've had issues with for, like I said, many years. And no, I am a big believer in this and how you do it, and the using my cells, and I would recommend it to anyone.
Well, thank you very much for taking the time to share your experience, and keep doing well.